There are 27.5 million people in the United States who do not have access to health care. Of the 91.5% that do, 67% of them are covered through private insurance and 34% of them are covered through government coverage, such as Medicaid and Medicare. Universal health coverage provides the entire population with access to good services, healthcare workers, medicines, technologies, basically meaning that we have access to all of these different healthcare services and don't have to worry about risking financial hardship when paying for them. We as Americans should have access to universal healthcare as it has been deemed by credible sources such as the World Health Organization as being a basic human right. As an ex-athlete who has played many different sports, many different years, and has recently just stopped, I have gone through many injuries, and I have been to many doctor's appointments, many hospital visits, you name it. These expenses, they just stack on top of each other, and they keep on stacking until it becomes overwhelming. Luckily, my family has been blessed and we've been able to put up the expenses for these services. But there are a lot of families who aren't as fortunate as mine, and I can 100% believe that had this been them going through it, they would have been completely wiped out. Not even just by one of them, let alone all of them. Today, I would like to discuss the financial impact that our current health system has on our society. And I'd like to talk about universal health coverage and how that could be the possible solution to our problem. As we all should know, within the healthcare system, they price everything extra high. This helps them pay doctors more. Another large sum of that money goes towards research and development to help create new services and products so that they can throw it at us, put the price on it as something really high and it's above the average person's allowance, and then the whole cycle can repeat itself. It's because of systems like this that families dread and avoid receiving health care, potentially putting their lives at risk to save a buck. According to a study from Consumer Reports, health care is one of the top financial problems for U.S. households. 46% of reported patients went to the emergency room instead of the doctor's office because that was the only place they could afford. That being said, emergency rooms are required by law to care for patients whether they can pay for it or not. The cost of, these specific statistics are from before the Affordable Care Act, also known as Obamacare, which was passed back in 2010. But keep in mind that this Obamacare was a measure they took because families were getting so financially crushed and wiped out at such a high rate that something had to be done. Prior to the Affordable Care Act, no measure has really been taken. The cost of healthcare also plays a significant role in the patient experience, from decisions on whether to even go receive healthcare to decisions about what the medical bill is going to look like after receiving the care. About half of U.S. adults say they or a family member have either skipped out on health services or looked elsewhere for the same service at a different price. Could there be a more clear sign? We have people literally risking their lives to not pay the prices. Why would we willingly bleed ourselves dry for something that we should already be receiving? At this point, it looks like our two options are either kill our bank account or kill our bodies. Luckily, there's a plan already set in place that lays out exactly what we need to do to fix this problem. Our country is designed to deny, not really support, the right to our health. Like I mentioned in the beginning of this speech, healthcare has been deemed by many credible sources as a basic human right. The American Bar Association summarized our history of the United States and the fellow UN members all agreeing to the UN's Declaration of Human Rights Committee that basically said health is essential. From this moment on, most, if not all, of the other industrialized countries have all put universal healthcare systems into place. The US is always doing everything it can to grow and to progress. So why are we so far behind everyone else when it comes to the overall health of the public? We are the only nation among the 37 OECD, also known as the Organization for Economic Cooperation and Development. We're the only nation of those 37 that does not have universal health care either already implemented or written as a constitutional right. It's even to the point where our health expenditures are 2.5 times higher than the rest of the OECD's. Ours is roughly sitting at about 8,509, and the average is around 3,389. Right from the mouth of the World Health Organization, universal health coverage is a critical component of sustainable development and poverty reduction, and a key effort to reduce social inequities, the hallmark of a government's commitment to the well-being of its citizens. One plan that I read a lot about is where we can basically spread the risk of the people who will get sick and all the people who will have to go get seen. We spread the risk of all the ill/sick people across everybody. This risk protection plan prevents people from being pushed into poverty in the event they do have to pay out of pocket. That being said, this system still very heavily focuses on making people not have to pay out of pocket and making it something where we just go, we have it already paid for, and we did. Now that we have discussed a way to fix the problems of this healthcare burden and learned about some of the history that supports universal healthcare as a right, let's take a moment to paint a picture of all the good that can come from this change. So sadly, due to the times we are in, hospital visits and doctor visits are at an all-time high. Myself included, I've lost a job, I've struggled. Everyone's been looking on how they're going to pay their next bills, how they're going to put food on their table, and then boom, someone catches COVID. We all know that COVID has varying degrees of severity, but nonetheless, it's nothing to be taken lightly. Now, visualize arriving at the hospital. You're already in your mind because you are already thinking about this very expensive bill that you're going to have to pay. But what if you walk in there knowing that you will get every treatment, every test, all the medicine, everything you need without having to pay a dime? And all that dread and agony in your head when you got there is vanished when you leave the hospital without a bill. I don't know many people that would turn this offer down. Would you? Universal health care would prompt so many people to really put an emphasis on their health. A strong and healthy public seems like a well-functioning and productive society. Now that we have discussed how our country's healthcare system is bleeding us dry, we can move on to see how much of an improvement universal health care would have on our country. About 62% of individual bankruptcies are medical related. The United States is already way behind everybody else, developed and non-developed countries, by being the only one to not implement universal health care to the people within its borders. If financing is the barrier holding us back between this reality, then we already set in place, or we already put out there, the plan of spreading the financial risk across everybody, medical expenses, they come from a wide variety of places. So if we spread them, everyone's protected. We don't worry about basically ruining our lives to go get medical help. Implementing universal health care is not an impossible task. All I ask is that we learn from the people who already have it down packed, already have it in place. If these small countries who have way less resources than us, way less manpower, way less money, if they can do it, then why can't we? Universal health care would prevent medical bankruptcies among families and individuals and improve the overall health of the public. We have a voice and we need to use it.